We've explored the K, kickstart of the KAER Toolkit for brain health. You may want to go back and watch that video first if you haven't seen it already. Let's move on to the next important step, A, which stands for assess. Once you've started the conversation with your patient about brain health, what's next? That's where assess comes in. It's just what it sounds like. We're going to conduct brief cognitive screening tests during the visit to detect if impairment exists. We're not talking about full neuropsychological batteries, just choosing a validated and brief cognitive screening test that makes sense for your practice.
The mini-cog really takes almost no training at all. It's as simple as 3 words someone's asked to remember and drawing a clock. And so you can teach someone how to do it or administer it in a minute or 2.
A very simple tool is the MoCA, which is short for Montreal Cognitive Assessment. It is a screening tool that helps us to look at multiple areas of cognition or thinking, so that it is not just about orientation and recall. Many of the other instruments out there look just at orientation and recall and don't help to ferret out some of the other areas of cognition where somebody may be having a change.
Think about how the tool fits into your existing structure and workflow, how long it takes to complete the test, what are the training requirements, and whether there's a fee to use the tool. Examples of validated cognitive screening tests include the AD8, SLUMS, and others. You can visit the KAER Toolkit online at kaerbrain.org for guidance on choosing the appropriate tool for your population and practice. Once you've selected your tool, here's how to integrate the assess step of the KAER Toolkit smoothly. After you've kick-started normalizing the topic, you can introduce the assessment test naturally. We're keeping an eye on your brain health today. I'd like to do a quick memory test and thinking check. It should only take a few minutes. You can use clinical staff such as medical assistants or nurses who've received the training to administer the test early in the visit, including the results in the medical record.
Training your staff to administer any of these quick cognitive assessments is relatively easy. You could do it in a 20-minute session, and then once they have the skills to do this, they can really implement it for all of the visits.
A lot of the assessment tools in the toolkit are tools that don't have to be done solely by the primary care provider. A member of your team could be trained to use these tools. It could be a registered nurse, an LPN, a medical assistant. Any of those members of your team could be trained to use that tool appropriately, successfully, and be a guide in that journey.
Score the assessment promptly and review it with the patient before closing the visit. Even subtle changes could signal early cognitive impairment. Remember, you're not diagnosing dementia here, we're just detecting cognitive impairment. We all know early detection is critical in providing the care our patients deserve. The KAER Toolkit emphasizes team participation. Encourage nurses and front desk employees to notify you when risks like polypharmacy or poorly managed diabetes or indicators of memory concerns such as missed appointments are detected. That teamwork can make assess an everyday part of all of your workflow, not an extra burden.
The earlier that we're able to detect dementia, it means that the earlier we're able to connect patients with the treatment and the care that they need to be able to manage this condition. And the earlier that we're able to diagnose it, the better it is not only for the patient, but also the family member.
If it is the diagnostic screeners that you may be doing, there may be, again, a medical assistant or an LPN who may be able to administer those tests. There's not one way to implement the GSA KAER Toolkit. There's lots of different ways that this could be implemented, but you need to be intentional about how you set this up so that it is a part of your workflow.
Consider repeat testing, especially for patients with subtle changes, chronic conditions, or who are just starting midlife. Tracking over time gives context and clarity, and again, normalizes these efforts. Finally, document the results of cognitive screening tests or any other relevant findings in the patient's medical record. Clinical finding of subtle but noticeable changes in cognition, even without formal diagnosis, should be noted. This signals to your clinical team during future visits to watch for changes and to plan follow-ups.
Cognitive health should be part of every annual exam. Like other things, it doesn't have to go deep, But if there's a concern, then I think every general practitioner should have a few tools there to help assess and be ready to make a referral as needed. Time matters and it makes a difference.
I think the earlier a person is diagnosed, the more chances you have of being able to support them. And there are a lot of resources out there.
To review, the assess step of the KAER means using a brief validated screening tool, integrating it into routine visits with your team, identifying cognitive changes early, and documenting and following up. All this sets the stage for the next steps, evaluate and refer, and supports better outcomes for your patients. You can learn more about the assess step and the entire GSA KAER Toolkit for brain health at kaerbrain.org.